Okay, we'll get started in just another minute or two, panelists. And we do have one more panelist that I expect to join. He may be a little bit late because he had something else up to this hour. For media who are in attendance, thank you so much for joining. And please, if you don't mind, to rename yourself in your Zoom profile. If you hover over your own window, there's a little three-dot menu in the corner, and you can click on rename. And if you indicate to us your full name and your media outlet, that'll help us when we are taking questions from you for our panel. So we do have some questions that we've prepared to get things started, but we do want to hear questions from you in the media, especially as you're encouraged to use any quotes from today's panel in anything that you're working on, as well as to follow up with the panelists to ask them additional questions or schedule your own interview. So you're welcome to use anything. If you give us questions that are relevant to what you're writing about, that's going to help the panelists to give you a good quote. And we want to also mention that we have a recording going, and we will have a transcript of the panel that will be available, and we'll send those to everyone who registered for the event as soon as they are available. If you didn't register for the event, send an email real quick to info@newswise.com, and we'll make sure to put you on the list for getting the recording and the transcript. We'll go ahead and get started. Welcome to this Newswise Live expert panel. Today we have 4 panelists to discuss topics related to education. Schools are holding virtual graduation ceremonies as students are finishing up a disrupted school year and they prepare for summer vacation that's largely going to be devoid of normal summer activity like camps and sports. The US Senate is currently holding a hearing in a committee about how to reopen America's colleges safely, and they're discussing plans such as how they might require masks in classrooms, ending the fall semester at Thanksgiving break, and whether or not every single student on campus should be tested and how to accomplish that. So these are some of the topics that we hope to address with our panelists today, as well as the impact of the pandemic on education, technology in the classroom, the comparison between in-person and remote learning. These are some of the topics that we'll get into, and we hope to get questions from you in the media about those. If you do have any questions, please chat them to us, and we'll invite for you to ask the question yourself live in the call, or if for whatever reason you can't do that, you can just chat us the question and I will ask it on your behalf. I would like to introduce our panelists. We have with us Professor Vanessa Dennan from Florida State University. She's professor of instructional systems and learning technologies in the Department of Educational Psychology and Learning Systems there at FSU. We also have Natalie Millman, and I'm just looking for Natalie's video to spotlight her. Natalie is a professor of educational technology and director of the Educational Technology Leadership Program at George Washington University. We also have with us Gary Ligori, and Gary Ligori is a PhD. He's the Dean of the College of Health Sciences at the University of Rhode Island. And his participation here was also made possible by the ACSM, of which he's a member. We will also hopefully have joining with us one other panelist who had another deadline that he was working on up to the hour. That's Robert Shuley, MD. He's an infectious disease specialist from UC San Diego Health. So as soon as he's able to join, we will make sure to acknowledge him and give him some questions. I did know that he would be potentially a few minutes late. We'll go ahead and start with a couple of questions. And for Dr. Ligori, what are the factors that are going to determine whether or not a school can reopen in the fall with on-campus versus relying more on remote learning? Let's make sure your audio is live.
I think you had highlighted a few of the areas, certain things like masks, et cetera, but the big macro picture is really just about safety in general, safety in the residence halls, safety in the dining halls, safety in the classrooms. So I think many schools are really being thoughtful about how they can do that. But then there are the minutia that come with that. So what happens if a student shows up to the classroom without a mask? With no ill intent, just simply forgot their mask. How do they handle that? And how do we handle class space sizes? That's a real issue we're struggling with now, because if we want to break up our larger classes, we simply run out of space at some point. So those are some of the big and little picture items that we have to deal with. But of course, safety is the number one issue right now. And then underlying that is fear, concern, and anxiety amongst faculty, staff, and students on whether it's safe to be on campus, on any campus.
Thank you, Dr. Ligori. To Professor Millman, do you think education will suffer under the proposals for reopening that are going to continue to disrupt regular school life with things like limiting students to one room or restricting access to buildings, especially with K through 12, but also in higher ed, and all these logistics? Is that just going to be a minefield? What do you think about that?
Well, it's a really complicated thing that you're asking. So there's really no easy answer. I would say that we're all suffering to some degree as it is during this pandemic. So to try to pinpoint, exactly what may or may not happen going forward, it's a complex, difficult thing. We know social emotional learning is extremely important, student well-being, safety. And then, of course, you factor in the fact that schools are often thought of as sanctuaries, safe spaces where students can come to learn, in many cases where they have food, shelter. It's a complicated question with, I don't think there's an easy answer.
Fair enough, Professor Millman. To Professor Dennan, how do you think students generally feel about coming to school and having it be a combination of in-person and remote learning?
I think that that's another really complicated issue. The people I've been talking to, the students who I've been talking to, are torn. They miss their friends. They miss their friends so terribly. And it would do wonderful things for them socially and emotionally to be back with their friends again, doing all of the normal age-appropriate things that they are normally doing. But when you probe deeper on that, you start to hear concern, even if not immediate concern for themselves and their own health. You start to hear concern for their family members' health and the potential spread of COVID-19 that could occur with that. I think everybody's looking to somebody else to make the decision for them right now, because it doesn't seem like there is a good decision to be made.
Definitely a lot of complication and uncertainty. And on that note, to Dr. Ligori, a lot of this debate and the discussion is about a lot of things that are partly outside of the school's control, such as the course of the pandemic and what's happening with their local communities and things like childcare and the public schools. So how can universities figure that out? And when is kind of a deadline to really make the call?
Yeah, there are a lot of things out of our control. Rhode Island is a bit of a unique state, given that we're so small. We work hand in hand with the state government, so that is a bit of an advantage. But nonetheless, daycares are just now opening and roughly at 1/3 capacity, and that's expected to stay until early September. So that presents a real challenge and creates anxiety amongst parents with young children. The public schools are unsure what they're going to do. And one of the plans they're talking about is having students come on alternate days, or just bringing in the young students or just bringing in the older students. But you can imagine the complications for individual families around that. Or for our campuses, not just the staff and faculty, but many of our students are older siblings to these kids and potentially caretakers to these kids. So there are so many variables out of our control. I feel fortunate we're in a small state that works closely with our government. I can only imagine in the larger states how complicated this must be.
Yeah, absolutely. To talk a little bit more about those complications and real on the ground work in this, we have Dr. Shuley now has joined us, and Dr. Shuley there at UC San Diego Health is working on the Return to Learn program, which is a sweeping effort to figure out how exactly to test the student body and implement things like contact tracing and how to handle if there is an outbreak. Dr. Shuley, welcome, and I hope you can fill us in on the progress with your program.
Sure. I mean, let me emphasize to begin with that although testing has been what's been talked about, it's only a part of a much larger program that everybody's been talking about. None of these pieces should be taken apart and put forward as the approach that will get us to where we need to go. Putting all these pieces together in a synergistic way is where we need to go. We see testing as an important component of it because our experience has been that if we rely on the student health service for people to show up, particularly college-age students, many of whom will not be symptomatic, or if they are symptomatic, the symptoms will be mild and they may be mistaken just for the crud that students get when they get busy. We felt it was necessary to have a bit more proactive attention to viral circulation on the campus. So we're trying to set up a program in which we would have relatively easy to acquire self-testing sites around the campus and residence halls, classrooms, at places of where commuters arrive to be able to capture our faculty and staff, because after all, we're one large community, faculty, staff, and students, designed to interact in a way that universities and schools interact. We interact with each other. So we think it's important to look carefully for virus before we are behind the 8 ball and have lots of sick people that puts us in a New York-like situation where it's very hard to catch up once you've missed the boat. So we have pilot tested this over the course of the last 3 weeks and tested about 1,500 students with this format. The format's pretty simple. They walk up to a box near their residence hall where there are a stack of swabs with QR codes on them. They have an app that attaches the QR code to their medical record number. When they activate the app and point at the QR code, they then swab their anterior turbinate, the front part of their nose, throw the swab into a plastic bag and throw the plastic bag into a box next to the box they started with and go on to class. It takes several minutes. We think that as we move to salivary testing in the fall, it should take more than a couple of minutes to get all this done. The samples then picked up, taken over to the hospital laboratory and put in the regular clinical run, and the results are coming back by the next morning, which lets us have time to contact them and employees and staff and try to begin to do the necessary mitigation. We're also going to look for virus in wastewater coming from individual dormitories and from other parts of the campus. Basically just trying to get ahead of what we think will be virus entry on campus and in schools in the fall.
Yeah, that's very interesting, Dr. Shuley. I'd like to ask you to expand on that because I believe that it's been covered pretty widely that viral shedding does seem to come out through the digestive tract. If you were able to detect viral shedding in wastewater from a particular dorm or particular part of campus, that could be a way that you could be tipped off to concentrate some testing in that area.
That's exactly right. I mean, it's the ultimate pooled test. There's a lot of interest in trying to pool nasal swabs and look at 8 or 10 at a time. You have a dormitory of 120 people. It's a great way to begin to focus in your testing. You can imagine the same thing being done in elementary schools and other places to look for early evidence that virus is circulating within schools and begin to be more vigilant. I think the whole key to education in the fall is not to start out with a plan that you know is going to be the one you follow all semester, but to try to have in place as much ability to monitor what's going on and have thought out in advance what you will do and what steps you can take when you begin to see triggers.
Has anyone done that kind of wastewater testing already, or is this something that's still kind of prospective?
It's been done in community levels. For many years, people used it as that's how polio was chased around the world, looking at wastewater. Polio virus is much hardier than coronavirus, but we know coronavirus can be found in, RNA can be found in wastewater. There was a very nice study done in Connecticut that looked at the appearance of coronavirus RNA in sludge in wastewater treatment plants, and that showed up before cases showed up actually in the community. So I think it's really very doable. We're going to start by looking in wastewater from our hospital just to make sure our techniques are working out, and then we'll start looking at dormitories.
Very interesting. Thank you, Dr. Shuley. If any of the media attendees have questions for any of our panelists, please do chat those to us. We'll invite you to ask the question yourself, or if for whatever reason you don't want to do that, I can ask the question on your behalf. I want to go back to Professor Millman to talk a little bit about kind of the educational environment and the incorporation of technology. From what Drs. Liguori and Shuley have told us, we're still not certain how it's going to exactly play out. So technology for learning, your wheelhouse is going to be invaluable, and parents, students, and educators all need to be prepared to adapt to that. What can you tell us, assuming that schools are going to use some combination of in-person and remote learning at least, what needs to be done to raise those standards? I'm sure there's a lot of parents that have been concerned that this emergency remote learning experiment that we've done in the spring semester this year wasn't quite up to the standards that we would hope with some better planning. How are we going to make that really work to ease parents and students' minds that they're getting a quality education still that way?
That's an excellent question. And if you look at the calendar, most of us, no matter what level of education you teach in, who are educators, you have about 3 months and the clock is ticking. And there are a lot of things that we can do now to prepare for the fall, whatever kind of, however we show up, whether we show up in a blended environment or fully in person or online, whatever it is. And I'm glad you made that distinction about this past spring and end of the academic year, in that it really was emergency remote teaching and learning. People had to switch to teaching remotely, and students all had to either go home if they were at residential colleges, and students, of course, at the K-12 level had to learn from home. And home is not always the most conducive place for learning. There's so many different configurations that you can think of, not only equipment, but experience, the tools that the schools already had. So this idea of, like, the clock is ticking, schools have, at all educational levels, have about 3 months. Now it's probably less than 3 months for a lot of places that start in early August. And they can be investing in some technology, not only hardware and software, but very, very important, providing their staff, their teaching staff, professional development so that they can design the best learning experiences that they possibly can for the fall.
Professor Dennan, how would you assess some of the challenges to this emergency remote learning experiment that we've undergone? And what lessons have we learned from that now that the clock's ticking, like Professor Millman said, a lot of K through 12 school systems are needing to prepare for that by the first week of August. What have we learned, and what can we start doing better as we prepare for the fall?
Well, to start with the challenges, I think the biggest challenge in some ways was that there was so much change happening across all spheres of life all at once. So we have people moving around to be in the locations they need to be in, then figuring out how to stay put in those locations with different configurations of households, children who are home who need to be watched. And that was a stressor for a lot of people. We also had to completely reconfigure the way that classes were going to work. That showed us some of the weaknesses that we have in our current system. And we talk about all of the educational technologies that we have and that we use, but they tend to get used a very different way in the face-to-face classroom than they are used in the online classroom. So even the teachers and faculty members who were well prepared and well versed at using those technologies to support their students on a daily basis in the classroom found themselves challenged to figure out how they were going to engage their students, connect with their students, do all of the communication things that they're so dependent on the face-to-face setting for remotely. For many of them, that meant online, but not in all cases, because again, the infrastructure wasn't there for all students to access remote learning in an online learning form, which created even more challenges, because that meant that instructors were finding themselves not having to teach their classes just one unplanned way, but potentially in multiple unplanned ways so that they could be meeting the needs of all of their students. Now you ask me, so what have we learned from this, and what can we take away from it? As Professor Millman said, we have the gift of time right now. We're not in emergency response critical condition. I hope we can use that time wisely. Some of the things that I see happening on my own campus are a lot of teaching preparation sessions where we're getting the folks on campus who have the expertise to share not just how to push the buttons on the software. And there were some people who didn't know how to do that back in the spring, but now to really choose how you're going to deliver your classes and figure out how you're going to engage your students, how to communicate with your students, how to make up for the lack of face-to-face social interactions that we may be facing when we return to campus in different configurations this fall, or perhaps for some of us don't end up returning physically to campus at all.
Well, those social interactions certainly are a valued part of all levels of education, as all of the panelists have mentioned. I want to ask Dr. Ligori, how much do you think that college social life plays in the desire of students to come back to campus? And how do you feel about some of that being obviously valuable and a crucial part of the experience, but things like parties and certain other social activities that might be frivolous during a pandemic are not necessarily the basis for a university to make a decision about this. In the Senate committee hearing that I was listening to as we were about to get started our panel, the Senate chair mentioned for a lot of the universities he was talking about who are definitely opening, that parties will be not allowed. I don't know how that's exactly going to be enforced, but how do you feel the social life of college factors into the decision about whether or not to reopen?
I'm looking forward to not allowing the parties. I'd like to see how that one works out. Social life is really important for a lot of people. Some of the other panelists mentioned social emotional health and well-being, and for a lot of students, that's why they choose to enroll in a residential campus. But for many of the students, it's a way to prepare them for whatever the next phase of their life is. And we probably will see in the American workplace more remote jobs after this pandemic ceases, but there's still going to be many, many opportunities for young people to move into the workforce where working together is critical. And they get part of that from living together. And even if they're not a residential student, they still have to interact on campus in ways that they may not be comfortable with. So many of the students really look forward to this. This is just such a monumental time in their life to go off to college and experience all of that. And to not have that opportunity, I think, is creating its own negative stress. So even if campus is open and the coursework is somewhat hybrid, I think that will bring a lot of sense of relief to students that they get to come back to campus in some way, shape, or form and be part of that social scene. I'm not going to touch the party issue.
Fair enough. For Dr. Shuley, with what you've implemented of the program to test college students, I wonder if you can extrapolate what you've learned from that and apply it to K through 12 education. And as I understand at UCSD, there is a 6th through 12th grade education program in school that you're working with to figure out how to implement some of these things for that environment. What can you tell about how that process is going?
We have an experimental school called the Preuss School on campus that is 6 through 12 and focuses primarily on kids who come from south of I-8, heavily Hispanic community close to the border, where we now have a raging outbreak of COVID. And we've been working with the principal of that school to try to figure out the best approach to trying to provide the best education in the fall that we can, and are looking into things such as safety on the buses that bring the kids to school, alternating days, some of the same discussions you've been having, providing some testing to be able to get an idea about activity in the school, looking at some of the wastewater, a lot of the same things we're doing on campus because they're basically part of our campus. And we hope that some of the things we learned from the campus experience can be extended to the Preuss School. Kids, the other thing that we've also are taking into account is that children are at low risk, but some of them have particularly high risk parents at home, and so parents and grandparents. So as you begin to think about having to de-densify classrooms, you might pay particular attention to students who would be particularly dangerous vectors about bringing a virus back home, and prioritizing keeping those children at home and really reaching out to them for education as best you can.
That's an interesting point, Dr. Shuley. And, social distancing within classrooms sounds like it's pretty difficult. I happen to ask my wife, who's an elementary school teacher, about what questions she might have for today's panel. And one of the points that she made was that because this classroom model has really evolved over the years, they often don't even have individual desks for every student, because the students work at group tables more often than having individual classrooms like I grew up with in the 80s. So how can we socially distance when we don't also have the equipment to do that? To Professor Millman, I'd love to ask a question about students with individualized learning needs. How can we fulfill those obligations and potentially using technology maybe as an alternative to putting them in restrictive classroom environments? Or I don't know necessarily how else that might be addressed, but this was another suggestion from my elementary school teacher wife, saying that policy is in place, that they're under an obligation to provide students with special needs certain conditions to facilitate their education, and having them stay in a classroom and not be allowed to leave that classroom all day, for example, is something that's untenable for students like that.
Right. That has been one of the big challenges that many schools across probably the world have had to grapple with. And my advice would be for the parent to work with the teacher and the special education teacher that's assigned to work with the student for that individualized education plan. Now, of course, there are a variety of technologies that can help. And actually, one of the benefits that we haven't talked about is that there are a lot of kids who are thriving in these remote environments because they're in stable homes, and perhaps they just aren't as social or find other ways to be social with other children or young adults and adolescents. But again, I would say working as a unit together with the teacher, the special education specialist that's assigned to the student, as well as the parent together, coming together to figure out how to address the individualized education plan.
Thank you, Professor Millman. We have a question from Charlotte Leboff. I would like to invite you to go ahead and ask that, Charlotte. Let's make sure your audio is live. There you go.
Thank you for doing this. This is such an enormous topic. One thing I wanted to ask is, of all the articles that I've been seeing, including an interview of Dr. Fauci that I read last night, everything talks about returning to in-person classrooms with the focus on the safety for the children. But teachers, there have been teachers that have died of COVID, including a 33-year-old gym teacher in New Jersey. So my question is, what about the issues of safety that this raises for faculty and staff? And what about teachers who might not feel comfortable returning to in-person classes if that's the decision that their school system makes?
Any of the panelists interested in responding to that, please feel free.
I'll be happy to take the first stab. I'm in contact with my faculty every day. So while it's not the K through 12 group, I think the issues are similar. There seems to be growing concern over the ability to return to campus safely. Or, like any other faculty, we have some who are older, we have some who are high risk or live with folks that are high risk. And then we also have many younger faculty with young children who don't know where their kids will be in the fall. So I think, Charlotte, you raised a really important point. To some degree, it's one of those points that are out of our control, as Tom mentioned earlier. Because if we want to come back to campus, but our faculty don't or can't, or our staff don't or can't, that becomes a real issue. And if I could just throw another piece in there, earlier the discussion about the public schools, many students rely on school buses. So how do you social distance on school buses? You have to double or triple the capacity of school buses, not to mention a lot of school bus drivers tend to be older. So I feel like for every resolution we come up with, there's 3, 4, 5, or 6 more questions that make it even more complicated.
Absolutely.
Any of the other panelists want to weigh in on this question? Thank you for your question, Charlotte.
Well,
I'd like to ask Dr. Shuley, in terms of the volume of testing that we're able to achieve, you referred to having tested about 1,500 students in the last month. In today's Senate committee hearing, the Senate chairman was talking about potentially being able to perform 40 to 50 million tests a month, I think, or maybe it was a 4 to 5-fold increase in how many tests we could achieve by September compared to what's being able to be done today. Do you see that as a reasonable projection of tripling or quadrupling the amount of testing that you're able to do now over the course of the next couple months, and by the time fall rolls around where it really matters to test as many people as possible? Let me make sure your audio is live there, Dr. Shuley. 1 second.
Okay.
Go right ahead.
Yeah, we're gradually continuing to ramp up in our hospital laboratory, and we'll continue to do so. I think one thing that also needs to be acknowledged is that the testing costs are only, and the testing prices are two different animals. At a time when there was a shortage of tests in the country, a couple of the national diagnostic companies essentially told the Trump administration they'd walk away unless they doubled the return from CMS on costs and raised the prices to $100 a test. It actually only costs about 40 or even less at scale to do these tests. And we should look more carefully at how we're allocating our resources. I think with scale, with pooling, with some of the more modern technologies, the cost of testing can be brought down below $20 a test. And we should be doing that as a public health priority. It's fine with me if the diagnostic companies want to continue to provide tests at $100 for medical purposes, and we're willing to pay for it. But there's no reason for this large-scale testing to keep our institutions safe or safe to be charged $100 a test because that's what they've been able to negotiate.
Thank you, Dr. Shuley. I want to ask a couple of the panelists this question because one of the concerns for universities is that if the learning experience isn't what students expect, some of them may opt to take time off. So I'd love to ask each of you what you think about that. Starting with Professor Dennan, any thoughts about how students might make that decision, the impact for them in finishing their education, their career path, or any advice that you might give to someone weighing that option?
I can see where someone's initial inclination could be to say, clearly, the right answer is to put a pause on my education right now and take a gap year, do something fabulous with that year, and wait it out so that I can come back to campus when campus will be normal. The only problem is that then when you start to focus on what would you do during that gap year and find that the options that one would normally hope for during a gap year, travel, internships, volunteering, none of that is normal either. So that puts some added strain. I've heard people making recommendations that students save money, stay local, perhaps go to their community colleges when they were planning on going to a 4-year college somewhere else. The challenge with that is that that's going to put an added stress, more students into that community college system that is not currently funded, not currently staffed to handle extra students. And of course, the economic ramifications of all of this are that as we take money away from the institutions, they have to make some really difficult decisions about where to make cuts. And the campus that you hope to go back to a year later isn't going to look quite the same way, isn't going to have everything in place if it has suffered such severe financial consequences of everybody leaving and doing something else for a year. I was reading something just yesterday that suggested here in the Florida system that, if something happened, like what if we did something drastic, like just close the system for a year, the state university system, that would be putting 100,000 people plus out of a job and onto the unemployment rolls. And so that creates even bigger systemic problems outside of just education. It's difficult to know what to do, and people are going to have to make this decision on a case-by-case basis.
Professor Millman, your thoughts about students considering taking a year off? What are the ramifications to that? And How likely are they to come back and graduate, or what other concerns would you want to address?
I think that's that question of if some do take time off, will they come back? And I think of students who aren't as secure at home socioeconomically, and they have to work. I mean, there are a lot of students right now that are working to support their families because of the economic situation in their household. That is a concern, that if they work, that they take time off and then they don't continue and finish their education. I have a nephew who's starting at a state college in another state, and he plans to start. And I have a daughter who's going to be a senior in college, and that didn't even cross her mind about whether or not to return. I think what we all have to accept is, no matter what educational level our children are in or we work in, that it's not going to be what it was like last fall. I mean, nothing is going to be the same or normal. And I think just having that in mind and preparing for that, I think will help us get through whatever the choices are. But I agree with all the points that Dr. Dennan made about, that all of the ramifications, and it really boils down to what is best for the individual.
Dr. Liguori, what are your thoughts about gap years off, and what would your advice be to any student thinking about that?
Well, like Professor Millman said, I think that there's always a risk when you step away from school that it's much more difficult to come back. At the same time, I think when we talk about these gap years, we have to acknowledge that it tends to widen the socioeconomic divide amongst America's college students, right? The people who come from comfortable homes can afford to do this in many ways, and other folks might not be able to. They're already working multiple jobs or caretaking, so there's so many risks involved. But I think, as the other panelists said, there's not a whole lot to do out there during this gap year. There aren't going to be jobs. There might be some volunteer opportunities. And while I think maybe staying local for school might be helpful and the wise move for some people, I think regardless, the thing that I would really encourage students and parents and families to think about is, even though it might not be the ideal year, you're moving 1 year closer to completing your college degree. And that, we know, is a transformational thing in the lives of many people. And I think also there is an opportunity here. I always want to see the silver lining. But there's an opportunity here to try and do something through this crisis that makes you that much more employable when we get to the end. I tell my own children, when this is all over and mine are going to apply for college, what are you going to tell the college committees that you did during the pandemic that was worthwhile? Don't just say you learned a new video game. Do something important. So I think college students have that same opportunity. What can they do during this? And I know it won't be easy for everyone. But there is an opportunity to do something important, even if it's just something local in your community.
Dr. Shuley, any thoughts about students opting to take time off instead of returning to campus? What would you say, and what would your advice be? Let's make sure your audio is live. My host privileges are not working. Can either of my colleagues unmute Dr. Shuley? There you go, Dr. Shuley.
Okay.
I think you're live.
No, I think what my colleagues have said is true. You have to think about doing something that makes that year worth spending away from your education. In the past, there were a lot of options. This year, there may be more limited options. But there are some options that may be COVID epidemic specific, going into places that have been particularly hard, and to help those communities come back. Communities that are reeling from the George Floyd experience. So there are places that I think people can meaningfully spend the time with the gap year. Although, if they're staying out of school to avoid the COVID risk, there would be no less risk in those settings than in school, and probably more. If they're doing it because they think the year of college is not what they signed up for, and they'd prefer to get back to more, quote, normal school, I guess that's something to consider. But we don't really know that we're going to have a vaccine in 2021 or 2022. And I think we need to be a little bit sanguine about thinking if we just get through this fall, it's all going to be over. We're planning for the fall semester, and we finished doing that. And 4 days later, we had to start thinking about winter term. And the same considerations are still in play. Vaccines are being worked on. The early results suggest that there is an immunogenicity, but protection from infection with exposure won't be demonstrable until we've actually deployed them in thousands of people and look to see whether those people, as opposed to those who got a placebo, were less likely to get infected or to get sick when the virus is circulating in the community. And that's not going to happen even if you gave me 200,000 doses of a vaccine to test a day. We wouldn't be able to have an answer from that result until next winter at the earliest. And we don't have that vaccine in hand right now, much less manufactured.
Good points, Dr. Shuley. Thank you. I want to go to Charlotte Leboff with another question. Charlotte, please go ahead.
Okay, let's see. Well, if college, this is a question on behalf of a lot of my friends who have students of college age. If colleges opt to return to in-person classes, how will parents know that safety precautions are being taken, and particularly in dormitories? And then also, will students be allowed to live off campus? And a lot of colleges are sort of predicated on having students do that, usually in their junior and senior years. And if that's the case, how will the colleges know that they're not bringing the virus back to the campus with them?
Any of our panelists like to take that question?
Well, about half of our students do live off campus, the seniors, juniors, and seniors. And we've done some mathematical modeling, the same modeling that we used to look at how much testing we need to do. Natasha Martin took this on and looked at the impact of going from single to triple to double rooms and different combinations thereof. And one thing to keep in mind is if you put everybody in single rooms, you displace more people to the community, all you're really doing is putting more students in houses that have 9 students that were built for 2 adults, 2 children 40 years ago. And you really haven't decreased the risk of COVID transmission in the overall community because we all come together every day for classes. So you have to, I think, look carefully at the housing scenario and then start thinking within the housing about how to mitigate the risk as best you can by we're going down to no more than 2-person rooms, and we're going to pay particular attention to bathrooms and how they're used and the cohorting and so forth. But there's not going to be a zero risk thing no matter what we do. As to communicating with parents, we're having we had a webinar for parents or prospective students last week, which went very well. We're going to continue to do that because we want to hear what their concerns are as well. Had an interaction with someone that I work with at NIH who has a child at Berkeley and told her what we were doing, and she was shocked. She said, I had no idea you all were doing all that. I feel much better now. So I think a lot of it has to do with our communication and trying to make it clear that we take it seriously too. We value their children and we value ourselves, and be reckless to bring people back when the epidemic doesn't tell us it's ready for us to come back.
Thank you, Dr. Shuley. To Dr. Millman, part of the premise of my question about students taking a year off, partly informed by a survey that Inside Higher Ed published recently, showing that the highest preference among students they surveyed, 75%, preferred an in-person learning experience. It dropped down to the mid-50s when you asked them if they would be okay with a combination of in-person and remote. So it seems like there's an assumption, a premise that in-person learning is better. Is it better enough to risk these concerns of a pandemic and exposing staff, faculty, and their family to a deadly virus?
My first response to that is I believe students need to make a distinction between their perceptions and experiences of the residential college experience and a well-designed online class. It's hard to take those two apart because what many students have experienced is a residential college experience, but that's not everyone's experience. And I like to push people on, making that distinction. Like, is it the online experience that you don't want to have, or is it that you don't want to not have that college experience where, you have all the things that we can talk about go with it, including the parties. Now, is virtual better or worse than online? Is it worth to risk our lives in order to meet together? You know, that's I think a question for the CDC to help us figure out. For doctors, we have a couple to help us figure out how to answer that. But one of the things that our dean of the School of Medicine spoke to our faculty last week, and she mentioned that this virus is pretty much endemic. So I think what we have to do is figure out how to live with it and how to mitigate, just as Dr. Schooley had mentioned, you know, even in dorms, you know, what can we do to minimize the spread of it? And then, of course, you know, whether or not it's the in-person, how that's structured, how that works, again, that's going to be based on the community, whether it's a K-12 classroom or higher education. In large part, it will be dictated by guidelines that are developed, and some may even be developed at the state level that have to be considered.
Professor Dennan, how close do you think virtual and remote learning can get to the value of in-person education?
I think that's an unfair question to ask, actually, because I think that both in-person and online education have tremendous value and are very high quality when they are appropriately designed and delivered by professionals who are prepared to do exactly that. And under normal conditions, well, under what normal meant in the past conditions, we have a large number of students who do complete their entirety of their studies online and are very pleased with it. And some of them say that they never want to go back to classroom learning. So we do need to take that under consideration. I think that the challenge that we had, you know, everybody complaining about classes this past spring, was that there was no time to plan. People who are going to start out this fall in a face-to-face context need to plan to pivot, because at any moment they could be told your class is moving online. So if they plan to pivot, if they design their course flow, if they design their course activities and assessments so that there is a backup plan and everything can smoothly move to being facilitated and delivered using some sort of technology, then they're going to be in a good position for that. If they don't plan, we're going to see repetition of what happened in the spring. And that's what I think people really struggled with. There was a lot of Zoom fatigue because the easiest thing for, let's say, a faculty member at a university who has a class of 100 and 150 people, the easiest thing for them to do in a crisis is to just shift online and lecture on Zoom. But then I challenge any of you to think about how much you want to sit there and listen to one person talk for 3 hours a week on Zoom nonstop. Because remember, that person doesn't know how to Zoom with breakout rooms yet, and doesn't know how to Zoom with polls and to build in interactions. We have an opportunity to be ready for all of that this fall, whether we're remote at the start or potentially remote at some point in between. And you know, I hope that we take that opportunity. And it's not all Zoom either, because there are wonderful things that we can do asynchronously. We can use collaborative learning. I have had students tell me in my online classes, and I've been teaching online for 20 years now, that they have had more interaction and engagement and got to know their fellow classmates and me better in the online class than they have in a face-to-face setting. So I hope we have the opportunity to show people that, if that's what it comes to this fall.
Thank you, Dr. Dennan. Dr. Shuley, what would you like to add to that?
I was going to say we've been talking primarily about pedagogy, but universities also are heavily engaged in research. And a lot of the things that we do for society and that will help us get out of this epidemic will come from universities. A lot of things we've been talking about today are innovations that can be generalized to society, and the universities are great places to work that out, including things like less expensive testing, mass approaches to testing, IT approaches to contact tracing. But also engaging our students in our research efforts is one of the things that we do at UC San Diego quite a bit. And that's one of the things that has been lost in the spring term. I think we did a pretty good job. I think the faculty did a fantastic job being able to just drop everything and be ready for Zoom classes that I agree are not elegant Zoom classes and will be better in the fall. But engaging students in our research labs have been things that we've lost and will have to be rethought if we are forced to stay apart in the fall.
Dr. Liguori, the question of possibly pivoting back to an emergency 100% remote learning environment again, that's been raised. We're seeing a lot of states reopen and a lot of people out and mixing about in public. There have been predictions of a possible second kind of wave and second spike of the pandemic. What signs are you looking for and are universities looking for to detect whether things get bad enough that drastic measure would need to be taken again? And how detrimental might that be? Or if we're prepared for it, can it be done with relative ease?
Well, so I think there's two questions. Are we prepared for it and what are we looking for? I think we are preparing. As was mentioned, we still have time and we'll continue to prepare for as long as we can. We're a little fortunate here. We don't start school till after Labor Day, which is late this year. So we have an extra few weeks on some of you. But there's going to be a lot of preparation that goes into it. And we have to be able to move back and forth between the modalities depending on the situation. We're looking probably at the same data most people are. We're looking at positive cases. You know, our percent in Rhode Island is down, hovering around 3, 4, 5%, which is really good. And we're looking, I think, also, and this is a little bit more subjective, but we're looking for behaviors. We're seeing what's happening with crowds. What are people doing? Our beaches just opened, or what are those behaviors like? Because that may be reflective of what we see if we open our campus and students come back. Again, the uniqueness of the small state, our governor actually says, I'll drive around and see what's happening. And in fact, she does. So, because you could circle our whole state in one day. So we're looking for both the objective measures that CDC is encouraging and the Department of Health are following, but we're also looking at those more anecdotal things, like what are the crowds doing? Are people doing things in public that we expect them to do as a reflection of what we might expect on our campus?
For Professors Millman and Dennan, you mentioned some of the strategies and techniques that have kind of come out of doing remote learning in an emergency situation and preparing for the fall semester. Could you name a couple of things, maybe 3 things each, if you can think of them, to recommend that educators do to really up their game in combining remote learning into their routine a little better?
I guess I'll go ahead. A couple of things that I would recommend. One is to be looking at teaching in a blended manner. That would be setting up one's materials so that if a student is absent, he or she can easily access those materials. And if you have to pivot overnight, day to day, I've been trying to tell some of my colleagues, like, what if you're teaching and your class at 7 p.m., they have to sanitize it because someone, you know, that they found had the virus and they want to sanitize that room, and now your class is canceled. What are you going to do? So thinking about different scenarios, planning for them. The other is, and this gets back to the social emotional learning. One very different thing about this past spring was that everyone started together in a normal beginning of the academic year, or semester for that matter. If we start in the fall, let's say remotely, there's a lot of orientation and reach out that needs to take place in order to help the students get acclimated to that learning environment. But I'm also thinking of even if you come and even if students meet in person, there's, we have to build community. We have to work with students to think about how we can engage them in the learning process, no matter what no matter what happens, and also to unpack what we've been living through. I mean, this is hard. It's hard on all of us. and for some extremely difficult. Some of us have experienced a great deal of loss. And I think, you know, that if there's anything that I have seen really come to the fore, it's that idea of caring and the need for social and emotional well-being.
Professor Dennan, what would you say to this? And I'll throw also into the mix, what about certain kinds of disciplines and fields of study that really require hands-on learning, such as nursing or kinds of technology? What kind of preparation would you recommend for professors teaching in those environments as well as others to improve how they do it?
Well, I have to start out by pointing out that all of these disciplines have been teaching online for years. There is a wealth of experience out there, and there is a wealth of research out there to support this. So it's a matter of going and finding it now while we have the time and the opportunity to read and learn, because we're not trying to pivot to remote overnight. So reaching out, even if it's not at your own institution, but to the people who know how to do this elsewhere, is probably the best way to figure out how to deal with discipline-specific needs, whether it's that your area feels that it is dependent on some sort of unique face-to-face interaction, or interacting with clients, or a lab-based or a performance-based component that feels like it's really difficult to do online. There are probably people who have already struggled with that and figured out how to do it quite well. Beyond that, in many ways, when you asked the initial question about what would we advise, I was thinking the same things as Professor Millman. It's critical to figure out how you're going to build your relationships and then maintain your relationships with your students. One of the things that I have been saying to people throughout our educational response to this pandemic is that the approach needs to be people first, content second, and technology third. We may all be relying heavily on the technology to provide that backbone of communication. But, you know, the content is what we're already planned for, and we're the experts on that. But it's that communication element with people. It's the social emotional component. You know, hi, I see you. How are you doing? Are you okay? Are you ready to learn? Do you know how to use the tools? All of that is the stuff that we need to work out. And learners who feel like they are seen and heard and acknowledged and valued are learners who are going to take the extra time to persevere when the technology doesn't work quite right, or when they don't immediately understand the content and they don't have somebody right there in that instant to answer the question for them. So as much as we can do, however we start out, if it's in the face-to-face classroom, to build those relationships even in ways we might not have in the past, so that if we have to shift to online, that we're prepared to do that and have good connections. Or for anybody who is starting out remote at the beginning of fall, who's used to only teaching in a face-to-face setting, they need to think about, how are you going to spend some extra time up front to get to know those students? Because you're not going to recognize them as the young woman in the pink sweater who always sits in the front row, or the guy who shows up 2 minutes late with a venti latte every class.
Thank you, Professor Dennan. I'd like to ask Dr. Liguori, and this may be our last question. So if any of the media attendees have additional questions, please do chat them to us and we'll try to fit them in. But for Dr. Liguori, we talked a lot about what might an initial plan be, or a list of plans in order of preference, a sudden pivot if the pandemic worsens. Tell us a little bit about what some of those priorities are, of what would be the ideal scenario, and what kind of red flags we really need to watch out for nationwide to determine whether or not that emergency remote learning needs to be kicked in again. If there's anything else that you can point out that would be really critical for us to be aware of in that.
Well, I think the ideal scenario is going back to what we all considered normal. But that's not realistic for the near future. So we're looking out for situations where we see anything that might be dire, any immediate spread, anything we can't quarantine. Dr. Schooley mentioned how we can, how many students we can fit in the residence halls, and we're looking at that, but also that we need some empty residence hall space if there's a need for quarantining. We're contacting local hotels who might be able to contract to do the same thing. So capacity is going to be a big issue. This is all assuming we can do the testing and tracing on the front end. But the minute there is an outbreak, how well can we contain it? So that is a bit of an unknown. You know, I think I really admire the work at UC San Diego that they're piloting already. What will be really interesting is what do they or anyone else do once there is an outbreak, and how well can it be contained? So I think that's probably the big unknown still that we go into, and how do we manage that? If we can manage it, then we can continue on with whatever plan we set. If we can't manage it, then we're going to have to go back to where we were late in the spring with the remote learning.
Thank you very much, Dr. Liguori. Thank you to all of our panelists. I feel like a lot of your responses would reassure a lot of the parents, students, and educators that I know. I hope that this has been useful for our media participants. We're going to have a recording and a transcript available for you, and we'll send that to you. If you've registered for today's event, you're already on the list to get that. If you didn't register, please send us an email to info@newswise.com, and we'll make sure to get you those materials. I want to thank Dr. Vanessa Dennan, Dr. Natalie Millman, Dr. Gary Liguori, and Dr. Robert Shuley. Thank you very much for joining, and thank you to the communicators at GW, Florida State, University of Rhode Island, and ACSM, and also UC San Diego and UCSD Health for helping to bring the panelists to our call today. Thank you all very much. Stay safe, stay healthy, and good luck.
Bye-bye.
Thank you.
Thanks, everyone.
Thanks, Tom.